Verbal and physical abuse against nurses. It's an issue nurse associations and hospitals are working to decrease. Our CBS 6 fact finder Tori Wells learned why those incidents occur in the first place and how one local hospital is giving nurses the tools to stop the issues before they actually start.
Sandi Tetler has cared for patients for 30 years.
And that's what we do as nurses. You can make a difference in one person's life.
It's a job that she loves, despite the pain that she's sometimes experienced.
I've been cursed at. I've never actually been physically assaulted, but I have seen and witnessed it.
Tetler says that verbal and physical assaults on nurses happens. A survey was released in 2011 by the Emergency Nurses Association. 54% of the nurses who responded nationwide reported experiencing physical violence and or verbal abuse in the week before. 42% reported experiencing verbal abuse only.
Basically, nurses just want to help their patients, and we can't do that if we're battling situations like violence and abuse.
Tetler is the president-elect of the New York Emergency Nurses Association, or ENA, and she's a nurse downstate. She says that mental health, trauma, Alzheimer's, alcohol, and drugs can all contribute to these incidents. That and the stress that's inherent in a hospital.
In 2010, New York made it a felony to assault a nurse. Albany County says it's prosecuted 7 cases with 4 convictions. Says some of the other cases were closed because of the mental health of the defendant. Tetler says the courtroom isn't the right option for every case, but she says these incidents need to be tracked so changes can be made.
Eye contact has a lot of meaning.
Here at Albany Med, this training is aimed at teaching de-escalation so that signs of stress are noticed early and diffused, giving nurses the tools to stop incidents before they happen.
The overarching goal is safety. Safety for the patients and safety for the staff.
Charles O'Donnell developed this class at Albany Med, offered to nurses beyond the ER. Before the training, O'Donnell says he was being called to calm patients down.
Would you like me to talk to that person?
But now that hardly ever happens. He says the nurses are handling situations themselves.
And that gives them a sense of empowerment, that they can kind of keep a situation under control, safe, and keep the avenues of communication open.
ENA says that de-escalation training is key. That and security measures like badge systems and panic buttons. Tetler says that attitudes in New York are changing as nurses and hospitals agree assaults don't have to be ignored. But she feels more needs to be done in some parts of the state to track incidents and learn from them.
And that's all that we keep trying to do. And I think for the most part, patients don't want to hurt nurses. They understand. Many patients call us the angels of God, you know, that we're there to help.
Tori Wells, CBS 6 News.